Today, we're going to talk about your rights during pregnancy and during the birth. Welcome to the Hypno-Baby channel. I'm Dr. Natalie Fizet. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. If you have religious beliefs, you have the right to have religious beliefs, of course, but specify them to the staff. Like I had a patient that in her religion, when the baby is born, everybody should shut up and the dad will say a prayer in the baby's ear, and that's the first thing the baby should be hearing is the prayer. But that's funny because every nurse and every time I went to the nurse station and my patient was in labor and was, in and out of the room, they would say, "Don't forget, you should not talk when the baby's." I'm like, "Okay, you're the 15th person to tell me this," and it was beautiful to. The baby was really listening to the prayer, like big eyes, and it was really a beautiful moment. So you have the right to have your religious beliefs respected. All right, don't throw tomatoes at me. The doctor has rights too. Okay. Okay, I'm not gonna be popular. Put your comments here if you want to bash doctors. Okay. By the way, I'm a family doctor. I'm not a OBGYN because sometimes they talk midwife or OBGYN, but there's family doctors too that deliver babies. And then I would follow the family as a general doctor also. But getting back to the rights of the doctor has the right to ask you not to film during the birth, to film him or her, because sometimes I would use the vacuum, the suction cup, and people would be like filming almost in my face, and and the doctor has his little space here. Some people would. I've had a small child that was attending the birth, and he was playing with car toys on the sterile table, which was not sterile anymore. But it was really like I was almost babysitting him. So that was not the best. But same thing if I don't want things to be filmed, like if I'm doing an episiotomy, because then you can put it on slow motion saying, oh, she did not do it right, and then let's sue or whatever. So if the doctor says let's not film for the baby or forceps, and it's usually for legal reasons that we don't want to have this film, and to be comfortable like doing. And sometimes we have, let's say that it's an emergency that the baby needs to get out, we would talk more forcefully, or let's say let's push or whatever. So we don't want that on film, and it's okay. We have the right to refuse to be filmed. We also have the right to ask, like, everybody except the birthing partner out, because we need, like, okay, there's we need to do ABC. Sometimes there's a second doctor that comes around. The situation is different. It's not like a big party, and it's okay. We have the right to ask them to wait outside until the baby's going to be out and everything's going to be fine, but we need our working space, and that's the doctor's right. The doctor also has the right to refuse, to not refuse, but tell a patient that they're not comfortable following them. It happened to me once in 25 years, 3,700 babies delivered. So the patient walked into my office, and I was like the fourth doctor she was seeing. So she was like shopping around. She had a list like this big, and I'm like, yeah, sure, let's go. And she goes, oh, the doctors do this and do that, and you're like, you're gonna do an episiotomy, and it was like I had all the I was condemned without a trial, basically, and I knew that I could not work with her because she did not trust. And at one point, you have to trust your healthcare provider, and it was like, okay, yeah, you're no good, and blah blah blah. So finally, at the end, I answered all the her question, but at the end of the appointment, I said, "I'm sorry, I cannot work with you. I'll find you another doctor because that's." if you're transferring, and you cannot like let a person, as a doctor, you cannot let a person saying, okay, well, take care of yourself if it's an emergency, like person is giving birth, but this was a regular appointment. So I said, I don't think we can work as a team because you have your preconceived notions, and I don't have your trust, and I need your trust to work as a group, as a team. So she's like, I never said that. And she got all offended. And I asked my secretary, call another, an OBGYN, and take an appointment for her, because that's my, if you're transferring a patient, you have to provide her with another healthcare provider, which we did. So she was like, I never said that. And her husband, which had been quiet the whole time, he goes, yeah, you said it. And she looked at him, and if her eyes had been like a machine gun, he would have been full of holes. But oh my God. But I was okay with that because I don't know how she delivered. I never heard of her after that. But if you don't trust your healthcare provider, there's a reason, and then you're better off by changing healthcare. I think the one I referred her to, she did not like him, and then she went on to another one, and that's where we lost track. But we never let her like, okay, well, good luck with that. We took the appointment, and she met with she was taken care by the other doctor, but it was not good enough for her either. I don't want to start a debate, but I'll start a debate. Put your impressions in the comments below. You have the right to deliver in your own clothes. At least at my hospital, that's what we did. You have the right to eat and drink during labor, unless you took a procedure. Let's say you took the epidural or other. Sometimes the anesthetist says, nothing by mouth after the epidural, and you already have an IV or whatever. But technically, you have the right to eat and drink during labor, and it makes sense because it's the equivalent of doing a marathon. Nobody would do a marathon without drinking, keeping themselves hydrated. So why do we do that to pregnant women? I don't know. Eating, usually you don't eat like a spaghetti or anything like this. You eat like you would eat in a marathon. So little snacks, little fruits or nuts and stuff that will keep your energy up. You have the right to be informed of the situation, and you have the right to ask the options, because often they will say you need a cesarean, but are there other options? Is there like the forceps? Can you wait? Or, is it just a question of time? So you have the right to ask for options, and you have the right to choose. And you also have to know that you're kind of talking for your baby. So there's decisions to be made for the baby. You should be implied in the process as parents, okay? You and your birthing partner, of course. I like to focus on the positive, but I was in a pediatric rotation, and I was at the NICU, and they had a patient that delivered way too early, like 22, 23 weeks, and the baby was so small. It was like a pound of butter, and the pediatrician was like trying to intubate the baby, and it's when we put a tube down the throat, how usually how big it is, but for that baby it was the size of a spaghetti, and he was like trying, the baby was coding, getting blue and everything. I don't want to be negative, but just to tell you. And at one point, the father came and he said, let the baby go, because it's not gonna. It has been like many minutes, and the baby's been crashing and everything. It's not gonna come back like live a normal life, because we saw the oxygen saturation. The baby was blue. The heart was stopping and everything, and the pediatrician would keep like trying to intubate, and then pushing all the medication. And at one point I saw the pediatrician like, and then the father asked again, like, can you stop, because it's our decision. And finally the pediatrician took a deep breath and put down the tube, and finally accepted what the parent was saying. But that should have been respected. I've had a couple of times the situation of my patient saying, I refuse blood transfusion. You have the right to. but that's really complicated because the situation changes, and you can say that at the office when you're alive and well, but if there was hemorrhage or whatever and you need a transfusion, I would always re-ask. Well, it never happened, but I would have had always re-ask, like, do you still want to not take the transfusion, which could be life-saving? Um, Luckily, it never happened, but it's not because you said it once that you cannot change your mind if you're faced with, a life and death decision. So you could change your mind. So it's okay to for the doctor to re-ask, because we took an oath to save lives, and that's what we want to do. You have the right to take pictures of yourself during the birth, and I think I don't think I've heard of a hospital saying no pictures or film. But I would add to that, be careful. Don't send them, like, post them everywhere on social media, because sometimes there's, you're exposed and you did not see, and it was like it's all over the net, and you're like kind of doing a show here. I don't know if you understand what I mean. Like, you're exposed. Your genitals are exposed. So always check the pictures first. And some birthing partners are really enthusiastic. Oh, baby's born, and then sending that, and there's like things that you regret posting on the internet. As much as I said, you have the right, you have the right, you have the right, and we would tell, like, I would tell my patient when they were like in labor, and they would say, I'm hot, I'm cold, and I'm like, you have the right, it's your day, you can change your mind, and you're doing big work. That's why they call it labor, and it's okay. You have the right to change your mind. Like, they would say, oh, I want a tub, so we would fill the tub with warm water, and they go, nah, change my mind, I want to sit on the ball. You have the right to a certain degree. I've had a patient that she did not take the Hypno-Baby course, but she was going natural, but cold turkey, I would say. So she was pushing, and in between two pushes, her boyfriend came really close to her face, and he goes, "You're doing great. Keep pushing." So she looks at him, stops on her tracks, and slaps him right on the face. And he was like, and we were all in shock. So he just left the room, and we had to go get him, and saying, she did not know it. It's pain talking, but it kind of ruined it for him. He was pouting when the baby was born. He was like a little happy, but not as happy as he would have been if that did not happen. So you don't have all the rights in the world to act up. Same thing, I've never been kicked. I've never been. I have a colleague that said, well, at one point, one of his patients threw a face lot on him, like straight in his face. And I never had that. The closest, sometimes, my patient would have her leg flare up, and I said, I've never been kicked, and it's not going to be today. And sure enough, when I saw her at the postpartum visit, she says, you told me don't kick me. I've never been kicked. You're not gonna be the first one. And I'm like, oh, I'm sorry. But you don't have all the rights to be hysterical and things like that. But you have the right to enjoy your day, and you have the right to be informed, and you have the right to ask questions, and you have the right to take decisions. Always take decision in your best interest and in your baby's interest. And if you're not sure what the situation is and what the options are, ask. Okay. I hate those movies where they take the husband apart and tell them, "Oh, your wife has a deadly disease or whatever." And I'm like, "No, it's the patient. She has to be the first one to know." And the whole family knows, like, she's dying, but she doesn't know. That makes absolutely no sense. We have a duty, legal obligation towards our patient, not the husband, not the family. That makes no sense, but it's for the drama of the movie. Like, oh, she doesn't know she's dying. The rest of the family does know. So you have your rights. It's up to you to exercise them. so often I had patients coming for their second baby saying, I did not enjoy my first birth because I felt not respected, I felt not heard. But you have to take your voice and you have to enjoy your birth. And the more you're gonna speak up, the best birth you're gonna have. See you on the next video.